Hello. First of all, a big thank you to Liz and Tracy for organizing this event. And I feel really privileged to be here and talk to you today. For everyone who doesn't know me, my name is Anja. I'm a biologist, physician assistant, and functional medicine practitioner. And today I want to talk about what happens or what has happened when keto doesn't work. First of all, I have no disclosures. But I do love and live a low-carb lifestyle, and I'm really striving to make it work and enjoyable for everyone who wants it. And another little disclaimer, I really don't know it all. I'm still learning from and with my patients along the path. So if someone comes into my clinic and says, well, I'm doing keto and it's not working, then of course we always troubleshoot first. Are there any carb creeps in? Sometimes people eat food that they're not supposed to eat and they don't know about it. Are we just impatient? Is the mitochondrial flexibility so poor or the mitochondrial dysfunction so bad that we just need a bit more patience? Or is the insulin so high that we just need to wait a little longer? Or are there cravings that are uncontrolled and people just putting something into their mouth without even realizing it? So these are all the things we work on first, or we work along the way. Because keto is actually working if it's properly applied. But today, I don't want to talk about those little things. I want to talk about it when keto really doesn't work. What if everything goes completely well? So this graph represents about 10 to 15% of my patients who are doing everything right, who are compliant and doing everything perfect, and keto is still not working. So this is not a real statistic, it's just my gut-felt feeling. But it's about that percentage of my patients who are really good, who are doing everything right, and it's still not working. So then we have to dig a little bit deeper. Let me introduce you to Jane. She's a 67-year-old female, and things are just not working well for her. So that's not her real name, but real story is a very, very true story. And she reflects that 10 to 15% of my patients coming into the clinic complaining that keto is not working for them. So here's Jane. She came to me because she had difficulties losing weight. She had several weight loss programs in the past, which was primarily low fat and low calories. Of course, her weight went down initially, but then it came all up again. So she was on that classic roller coaster. She has heard of keto, and then she tried the same with her friends, including her husband. So by the time she saw me, she was on a strict ketogenic diet for about 12 weeks. She has monitoring her carbs and she was under 30 grams a day. And she measured her ketones as well, like most people that start on a ketogenic diet. And it was never above 0.2. She was on a time-restricted eating. She was eating for 6 hours and has been fasting for 16. And she rarely snacked in between. So she was really, really good. She said it wasn't always easy, but she has heard about it. The more, if you don't snack, the better. But she was not losing weight as everyone else around her, including her husband. So on top of it, she complained about fatigue and brain fog, and she had several GI symptoms like bloating and had some constipation, didn't feel too good. And she said her GI symptoms are actually worse since she started the keto. Her past medical history is not that exciting. So she has some frequent UTIs, which she doesn't like. But she suffers from reflux, which she takes pantoprazole for, and she suffers from insomnia, meaning she can't sleep very well. And she takes valerium whenever she feels like she has a particularly bad night, but she reports that it's not very effective. Over the last couple of years, she actually developed an allergy to amoxicillin, which basically gave her a rash and a bit of itch. And she reports these sort of food sensitivities, which vary in frequency. So sometimes she said, some foods are okay, and then I have the same food another time, and it's not okay. So these food sensitivities have been very inconsistent. As for her social history, she worked in the Australian Public Service. She was on an executive level, and she describes it as very stressful and bullying because it was quite a boys' club, as she said. She's happily married, has very supportive friends, and is active in a religious community. She goes to the gym 5 times a week and she jogs her dog, as she said. She's a non-smoker, she denies any illicit drugs, and she drinks 2 to 3 glasses of dry wine most evenings. Dry wine because she's very aware of the carbohydrates, and dry wine is supposedly okay with the ketogenic diet. And she primarily uses that one as stress relief. So on the surface, everything seems to be all right. There doesn't seem to be anything wrong. She seems to do okay, but she's not losing weight and she's not feeling better. So we have to dig a little bit deeper. So this is my timeline. This is how I take histories in the clinic. It doesn't look as organized as it is here, but because I scribble all over the place, but just to give her a bit of a rundown what's happening in her life. So she was born full term, and she entered the world with a normal delivery. Her mom, however, was quite stressed during her pregnancy with her because she had a very controlling husband. She's not quite sure if she was bottle fed or breastfed, but again, she remembers her mom of being depressed most of the time. So she was raised by her granny quite the majority of her childhood. At the age of 5, her parents divorced, and during her entire childhood, she had some frequent upper respiratory tract infections, had some ear infections, and which required frequent antibiotics. At the age of 8, someone took her tonsils out because apparently they have been too large. She describes her childhood quite intense as dramatic because her father was quite controlling, and there was, since the divorce, she suffered with her mom quite significant financial insecurity at times. At school, she was bullied a lot because of her weight. At the age of 13, a family member sexually abused her, and she developed this sort of negative body image since then. And late teenage years, she had lots of acne, which required lots of antibiotics as well. In her early 20s, she had an abusive relationship, but which she quit after about 3 years. Then 3 years later, she got married, and she's still married to that husband today, and she describes a very happy marriage. 2 years later, she had a miscarriage at 8 weeks, which was followed by a normal pregnancy 2 years later on. So she gave birth to her first son. And in retrospect, she said she may have had some postnatal depression. So wasn't quite diagnosed, but she thinks that's what happened. So since her early 20s, she has these sort of inconsistent GI symptoms, and she also started having these weight problems, and she started developing frequent UTIs. 2 years later, at the age of 32, she gave birth to her second son. This time she had gestational diabetes, and she also was diagnosed with postnatal depression. At the age of 35, her grandmother died, and that was a significant stress event for her because her grandmother was very close to her because she was the one that primarily raised her as a child. At the age of 43, she entered menopause, and she described she had lots and lots of symptoms. At the same time, the insomnia started. Now, the insomnia actually started when her grandmother died, so that's when she really struggled with sleeping. When she turned 52, around that time, her first son estranged a little bit, and he separated himself from the family. There have been some family issues going on. At the age of 62, her husband had a significant car accident, and she became her main carer. So that was the time when she actually quit her job, her job, which she describes as very stressful with lots of bullying and as a boys' club. So it was probably a good decision. And so she looked after her husband, who, by the way, recovered well, and they're happy and active together now. And at the age of 67, recently she started a ketogenic diet. So again, I also look into the diet. What do they eat? So previously she had a standard Australian diet, which is high in processed foods. She had multiple crash diets, which was low fat, low calorie. She has been eating lots of convenience food, and now, since she is on a low carb diet, she has a lot of low carb bread. As for the environment, so I'm basically looking for toxins and any environmental disturbances. So she eats a lot of non-organic foods. She has alcohol most of the nights. She drinks water from plastic bottles, stores food in plastic containers, and she drinks tap water, and she uses fluorinated toothpaste. And she had lots of amalgam fillings. As for relaxation and social support, she has lots of supportive friends, including her hubby. She's active in a religious community, and she walks to relax, and praying. She engages in prayers pretty much daily to help her relax. Her current stressors are her estranged son, as well as her health and weight issues, and watching the news stresses her out significantly. Her sleep was described as poor quality. She wakes up unrefreshed, she wakes up early, and it's sometimes interrupted with thoughts. And her movement, so she's going to the gym and she's jogging her dog. And I'm summarizing her symptoms on the next slide. I often give my patients what's called a medical symptom questionnaire, or MSQ, so where they can rate all the symptoms which they have on a score of 0 to 4. So her main symptoms have been the poor memory, poor concentration, difficulties making decisions, having headaches, insomnia, has got some joint pain and stiffness and muscle pains. She feels very fatigued and sluggish. She has also the frequent illnesses, as we mentioned before, the frequent UTIs. She's got mood swings, she's got cravings, she's got binge eating at the time, even though she tries not to, but she does have the craving. She's got, she feels bloated, she passes gas, she's got some heartburn, and so forth. So all of this is lining up to an MSQ score of about 100. So my average patient scores between 80 and 150, and I had a patient that was close to 180. But good health is defined as an MSQ score below 15. So they're basically all her symptoms which she struggled with on a daily basis. So when I saw her in the clinic, she was a well-looking lady. She had this sort of very positive radiation. Her blood pressure was a little bit elevated, but her chest was clear, her heart sounded okay, and she had some mild pitting edema, ankle edema. Her abdomen was soft, non-tender, her pupils reacted to light. However, when I held a light into her eyes, her pupils sort of started to widen a tiny little bit again, so she was unable to hold the constriction. At her teeth, she had some extensive dental work done. The tongue was showing some scalloping, so scalloping is these sort of small indentations at the edge of the tongue, and she had some mild coating on it. Her nails showed leukonychia, which is sometimes these little white dots on your nails. They have been a little bit brittle, and she had this sort of longitudinal ridging. And her hair and her skin was quite dry. So based on that story and that physical examination, what goes through my head? What am I thinking right now? So I think maybe she has got some nutrient deficiencies. She has a HPA dysfunction. She may have some suboptimal thyroid functioning, and she may have a dysbiosis. And I'm going through this step by step to explain why I'm thinking this. So based on her story, history, and her physical examination, so what am I thinking right now? So I definitely think, are there some nutrient deficiencies? Does she have a HPA dysfunction, which is the adrenal dysfunction? Does she have some optimal thyroid functioning, or does she have a dysbiosis? And I explain each step one by one in the following slide. So what makes me think that she has nutrient deficiencies? What are the clues which I was taking from the history and from her physical examination to make that decision? So first of all, in her history, she had a standard Australian diet most of her life, which is by definition not very nutrient rich. Her story also suggests that she has dysbiosis. Dysbiosis means that the wrong bacteria are living in the wrong ratios in your gut. So having dysbiosis in turn leads to nutrient deficiencies, because dysbiosis is basically sabotaging your nutrient uptake. She eats non-organic foods, which are usually very low in nutrients but high in pesticides. She's on medications, pantoprazole. So that's a medication that actually decreases the acidity of your stomach. That's the medication she's taking for her GORD or reflux symptoms. And that disables her to digest and process her food properly. And again, here on her nails have been shown leukonychia. Remember, they're the little white dots on your nails. They're brittle and they have these longitudinal ridges. And she's got dry skin and hair. So all of these are indications for selenium deficiency or zinc deficiency or a deficiency in essential fatty acids. So what makes me think she has a HPA dysfunction? Let's have a look at that. So let me just quickly recapture what the HPA axis actually is. So we have the adrenals, which is DA, sitting on top of our kidneys, and they are the organs that are responsive for stress response. So what happens? We have a stress event. So then the hypothalamus secretes a hormone called corticotropin releasing hormone, or CRH, which triggers the pituitary gland sitting right underneath. And that triggers another release of adrenocorticotropic hormones, and that triggers the adrenal glands to secrete cortisol. At the same time, the sympathetic nervous system kicks in, and it also stimulates the adrenals, secreting adrenaline and noradrenaline. So this axis is basically designed to help us to survive. So what are the effects of these stress hormones? Well, at the medulla of the adrenal glands, adrenaline and noradrenaline get secreted, and they increase the heart rate, the blood pressure, and they also dilate the pupils, because when we run away from the tiger, we need to see everything like big and wide, and we need to have a really good vision, because otherwise we can't run away and get all the information in. So it also enables that the blood is going diverted into the muscles. We want to be running. We want to be fit enough to run away from the tiger. So, and at the cortex, cortisol gets stimulated. So that's a different part of the adrenal glands. So what does cortisol do? It basically tells the liver to make sugar, gluconeogenesis. So the liver, when under stress, the liver can make a copious amount of sugar. So that's the quick energy available. It also tells the kidney to retain salt, because we don't want to have to go to the toilet when we have to run away from the tiger, because with salt retention, water retention follows. So where salt goes, water follows. So that also helps increasing the blood pressure, because we have a higher volume circulating in our blood, because we want to have that strong power available to run away. At the same time, it decreases the immune system. The immune system utilizes a huge amount of energy. So, but when we run away from the tiger for a short time, well, we can't just think about, if we fix that disease or not. So the immune system gets shut down. So we basically divert all the energy into the vascular and into the muscle system. And we also stop digesting, because digesting can only happen when we rest and when we relax. So, and when we run away from the tiger, we don't have to digest. So the body basically prepares you to survive a threatening situation. So if you keep all of these symptoms in mind, how would you feel if you live in a stress situation or in a fight and flight situation most of the days or every day? Can you see the analogies here? So what are these clinical signs in Jane that made me think, oh my God, maybe she has got a HPA dysfunction? Well, she has a mild elevated blood pressure. She has got mild pitting edema. So when you push on someone's skin at their ankles and the indentation stays a little longer, that's pitting edema. And she had her pupils widened with light. So she went straight back into this sympathetic motor system. So what makes me think that she has thyroid dysfunction? Let's have a look at that. So again, I want to quickly recapture what the HPT axis is. And this time we involve the thyroid. So it all starts with the hypothalamus again. So the hypothalamus secretes TRH, or thyroprotein releasing hormone. So that gets a signal to the pituitary gland. And that signal that secretes TSH, which is the thyroid stimulating hormone. And that triggers the thyroid to make thyroid hormone T4, which is the inactive form of our thyroid hormones. So that needs to be converted in the liver and in the gut to the active form of T3. So T4 is not doing anything to our system, but T3 is. So what does thyroid hormones do? So they determine what your metabolism is, they determine how well you digest, they determine what your heart rate is, they determine what your body temperature is. So overall, how you function. So your thyroid hormones are very, very important to your overall health and functioning. But then something else is happening, and I want to point the attention here to the reverse T3. So that's like, it looks chemically like T3, like the active form, but sometimes the body needs to put a breaking point or needs to slow down the metabolism a little bit. And then it converts the active form back into an inactive form, which is called reverse T3. And they compete for binding sites. So let's have a look which factors are necessary for normal thyroid functioning. So there's a bunch of nutrients very, very essential for just simple normal thyroid functioning, which is the iron, the zinc, the selenium, the B vitamins, the E vitamins, and tyrosine. So then there are some factors that are actually involved in the conversion from T4 to T3. And again, there are nutrients like selenium and zinc, but also we need to have a very healthy liver and a healthy gut. And then there are some factors that determine the sensitivity at the cellular level. Every single cell in our body can respond to thyroid hormones, but they need to be sensitive to it, and we need vitamin A and zinc to it, and a little bit of exercises help as well. So then we have some factors that can sabotage the entire axis, which is stress, toxins, and when I'm talking about toxins, primarily plasticizers and toxins we have in our personal care products, but of course all the pesticides that are on foods as well. Infection or inflammation that can also sabotage your thyroid hormone from even being made. And fluoride. Fluoride blocks the uptake of iodine into the thyroid. So fluoride is really not a healthy thing to have. And factors that increase the conversion from the active form to the inactive form, reverse T3. And again, here we have stress and trauma and toxins, again, infection and inflammation, insulin resistance, liver or renal dysfunction, and a low-calorie diet. So this is normal. This is how our system basically reduces the metabolism when the body is under stress. And when we put the two axes next to each other now, so at the top is the HPA axis involving the adrenals, and at the bottom is the HPT axis involving the thyroid. So if the body is under stress, what happens? The corticotropin releasing hormone inhibits TRH and TSH. So the whole cascade gets stopped quite early on. And if we have too much cortisol in our system, that blocks the TRH making, but it also blocks the conversion from T4 to T3, as well as it basically encourages T4 and T3 to be converted into reverse T3. So this is a normal response to stress. There's nothing abnormal here. This is your body tries to prevent energy wastage. So an altered thyroid function ultimately leads to a reduced metabolism. Coming back to Jane, so yeah, she had a dry skin and nails, which can also be linked to a low thyroid function. She did have some mild pitting edema, which could be explained by salt and water retention. She didn't have an enlarged thyroid and she didn't have any palpable nodules, so that's good. So what makes me think she had dysbiosis though? So just a brief summary of how leaky gut and or dysbiosis are sort of going hand in hand. So normally we have these epithelial cells here, very tied together, and they're all linked with these tight junctions. So that allows that the intestinal mucosal barrier only allowing small particles and small molecules like minerals and vitamins coming into the bloodstream. So if you have a poor diet or it's rich in sugar and gluten or drink alcohol or have certain medications, toxins or pathogens, all of these irritants basically contributing to the aggravation of these cells. So over time, these epithelial cells become inflamed. And then they release something which is called zonulin. So zonulin is the gatekeeper. They basically should leave everything toxic out and should let everything good in. But if the inflammation is an ongoing thing, the release of zonulin basically breaking down these tight junctions. So they're breaking down, which leads to an increased permeability. And as a consequence, all of these sort of toxic and harmful particles enter into the bloodstream. And then they basically are free and they can go anywhere. And that leads to symptoms. And don't even once think that only because you have a gut problem, you only have got gut symptoms. So all of these toxins, which are happily going through the intestinal barrier, they basically have access to everywhere. And we can have all of these symptoms: brain fog, depression, insomnia, ADHD, low energy, tiredness, a poor metabolism. We can have thyroid disorders. There is actually a gut-thyroid connection because the microbiome influences what our immunity is and what our nutrient absorption is. Remember, we just talked about how important certain nutrients are for just basic normal thyroid function. And of course, there's also HPA, so there's also a gut-adrenal connection. All of these inflammatory mediators that coming from the gut go straight into the blood. And that affects brain function and the release of cortisol. And that has its own sort of consequences, which I'm going to explain in a second. What are the clinical signs of dysbiosis? Well, her tongue had this sort of mild coating. So whenever there's slightly yellowish or slightly whitish coating, not whitish as in fungal disease, but whenever the tongue is coated, that's a sure sign of dysbiosis. She had extensive dental work done. And here's always the question, okay, what's first, the chicken or the egg? But dysbiosis, which often means, which leads to an acidic metabolism. So if we have an acidic metabolism, that has a toll on our teeth because the teeth are suffering from that acidity. And that ultimately leads to poor oral health. She's got reflux, probably from a high-carb diet, but it could also be dysbiosis. And she has got nutrient deficiencies. Nutrient deficiencies are once either caused by not enough intake, but secondly also to poor absorption in the gastrointestinal tract. And she's got medications. Here's the pantoprazole again. So pantoprazole is that proton pump inhibitor, which basically reduces the acidity in your stomach, which leads to a reduction of the ability to digest your food. So if the acidity is not adequate enough, people just simply don't digest their food properly. And that can lead to small intestinal bacterial overgrowth or SIBO and leaky gut. And also, she had frequent medications over her life. So it started in early childhood and it hasn't really stopped, really. So frequent antibiotics are just killer number one for the microbiome. So it takes on average 6 months to a year to recover from just one dose of antibiotics or one course of antibiotics. So just imagine what sort of impact that would have had on Jane's gut. So go back to her timeline and find the evidence in there, which all puts it together. So frequent stressors in life really puts the HPA axis a notch up. So there's so much research saying if your mom had stress while she was pregnant with you, that sets the HPA axis a little bit higher. She had throughout her childhood, she had so many stressors, one after one after one, and the evidence was basically in her symptoms. She had the weight problems. She had frequent infections. She has postnatal depression, poor sleep quality. She doesn't wake up refreshed. She wakes up early. So all of these symptoms are basically related to a poor HPA axis. So then also clues for thyroid dysfunction. So she ate convenience food, which are often high in toxins. Low carb bread is a huge huge source of gluten, and there's so much research saying that gluten and Hashimoto's thyroiditis are linked with each other, or low thyroid function. So she's got toxins in her life, which is the non-organic foods and the plastics and the amalgams, and also the fluoride in her toothpaste. She's got this brain fog, headaches, muscle pains, all evidence for sort of thyroid dysfunction. And of course, we see the evidence for dysbiosis, that she was on a standard Australian diet with high processed foods for most of the time. She's got constipation. She just doesn't feel well, and she had this sort of frequent antibiotics in her life, which can only contribute to really, really poor gut health. Of course, some of the doctors, you might think, okay, a differential diagnosis is hyperparathyroidism, but her previous calcium and PHT was all normal, as well as maybe pelvic malignancy, but she had an ultrasound just 5 months ago, and that was all normal as well. So now I've taken the history and I already made up my mind what the things are that are going wrong and what may contribute to her signs and symptoms. And the next thing is giving her a pathology slip and do more investigations. So of course I want to know where we're up to metabolically. So I take the FBCs, so full blood count and insulin and C-peptide and homocysteine and high sensitive CRP. I want to know about selenium and zinc and vitamin D. And of course, I want to have a full thyroid panel, including the antibodies. I'm going to order a cortisol awakening response. So I want to know what the adrenal response is. And I want to test her microbiome. So that's a stool testing. So I sent her home with this huge pathology slip, as well as some checklist things she can do already. So how can we de-stress? How can we detox our lives? And how can we improve our sleep? And I would send her home with an initial treatment plan, which is basically a targeted based on assumption and what I have learned from the history. So on this checklist, there's lots of things you can do. It doesn't cost any money, but little bits and pieces you can do to improve your health. So 3 weeks later, I saw her again with all the pathology results, and I had a chat with her how she was going with the implementation of some lifestyle changes. So basically what I gave her on the checklist and do some troubleshooting. So, and here's what we did. Her insulin levels came back elevated. So I prefer to have insulin under 6. And I put the normal ranges here. And when I say normal, I'm referring to what's functional normal. So most of the reference ranges from standard pathologies are a little bit different, but that doesn't always reflect optimal health. So I'm going as per what is normal functional health. So her insulin is definitely elevated. Her C-peptide is in normal ranges, means she has a good reserve. And her HbA1c is just borderline diabetic, so it's at 5.8. So she's not diabetic yet, but it probably doesn't take much more to become a diabetic. So she's basically on the fast lane. Her liver functions are a little bit elevated. And again, here I'm referring to the reference ranges which we had about 50 years ago. As we all get a little bit more unwell and bigger and more sick, the reference ranges have been shifting over the years, pretending that nothing is there. But I usually go for the reference ranges which we had when chronic diseases have not been much of an issue. So combined, so the GGT is elevated as well as the homocysteine. So that in itself is telling me she's not detoxifying well. She's not methylating well. And homocysteine combined with the high sensitive CRP, that tells me there's low-grade inflammation going on. So ideally, I would like to see the high sensitive CRP under 1 and the homocysteine under 7. So she has a detoxification as well as low-grade inflammatory problem. And remember, inflammation contributes to poor tissue sensitivity of thyroid hormones as well as a poor conversion. So here's some evidence why her thyroid may not work properly. Her vitamin D levels are, for my taste, way too low. So I usually aim to around 125. Her zinc is decreased. Remember, we need zinc for just pretty much everything, but especially we need zinc for DNA repair and trafficking and for normal thyroid function. So zinc is definitely too low, and copper is a touch on the higher end. So zinc and copper compete with each other. So I want to bring the copper down and bring the zinc up for better functioning. Her magnesium levels are just outside normal range, so that's pretty low. Again, we need magnesium for so many thyroid functioning, and also it's the anti-stress mineral, and it's like if the magnesium in the blood is low, so then I know that the tissue magnesium is particularly low, and that's what we need. That's where the stress actually is. Her calcium levels are on the higher end of normal, and a low magnesium combined with a high calcium level, that increases the release of stress hormones, again lowering even further the tissue magnesium, especially under conditions of stress. Her iron levels or her ferritin level is way too low. Again, some pathologists think that's all okay. I don't think so. I usually aim at least over 100. She's eating meat, And if you eat meat and you don't have heavy periods and you don't have any gastrointestinal bleeding and your ferritin levels are still low, you need to fix your gut. So of course we need to rule out anything other than just, poor absorption or the gut. But that was ruled out with her. So there was nothing else that could explain this chronically low iron levels. And she was telling me, oh yeah, I always had issues with my iron. But since we shift the reference ranges and now we can have iron levels or ferritin levels as low as 15, we just pretend everything is fine. It's not, guys. It's absolutely not fine. Iron is not only important for normal thyroid function, but also to make enough hemoglobin and keep normal red cells. So here's the hemoglobin. So she just keeps it up. She's at the lower end of normal. And her MCV, which is the medium corpus volume, which is basically a reflection of the size of her red blood cells, it's at the lower end of normal as well. So that's probably all coming from the low ferritin levels. Again, she just keeps it up, but probably not enough to feel happy and vibrant. Here's your full thyroid panel. Her TSH level is 3.1. Again, normally pathology thinks everything up to 4.5 or even 5 is normal. I don't think so. I usually get suspicious when the TSH level is above 2.5. Her T4 is okay, but her T3 is on the lower end. And if you take the ratio T3 to T4, it's at 0.15. What it means, she is very low because it should be over 0.33. But what it means, she's not converting her inactive thyroid hormones properly. Remember, the conversion takes place in the liver and in the gut. So she is not converting enough T4 to T3. That's one problem. And she also preferentially converts it to reverse T3. So her reverse T3 levels are quite high. And if you take that ratio, T3 to reverse T3, it's 0.6, which should be ideally between 1.2 and 2.2. So what that means that not only does she revert all her T3 back to reverse T3, but she also reverts T4 to T3 as well, to reverse T3 as well. That's the breaking point. Reverse T3 doesn't do anything to help you. It's the breaking of the system, slowing the system down. And her antibodies have been slightly elevated. So in functional medicine, I don't believe there should be any reference range. But so there's evidence that her immune system may have started attacking her thyroid already. And maybe if we don't do anything, she may end up with Hashimoto's thyroiditis in the future. So she had some antibodies floating around already. That's not good. And the rest of her bloods have been normal. So she had normal white cell count, she had normal renal function, normal folate, B12, and lipids have been normal. So now coming to her cortisol saliva test. So here is a normal curve. So the green line represents your normal response of cortisol over the day. So when we wake up in the morning, we should wake up with a low level, but then waking up is a stress response. So it's like a little mini stress. So when we think about back when we've been cave women and men, so waking up and facing the day is a type of stress. So because you have to hunt your breakfast. So what happens? Your adrenals are making cortisol, telling the liver to make sugar. Here's your breakfast. So that's the reason why no one needs breakfast in the morning. So at the 30 minutes, you should have elevated cortisol levels, and then at 60 minutes, it should drop down, and then it should go gradually down over the day. So now let's have a look what Jane's cortisol test was. That's quite high. Jane starts high in the day, so which tells me she probably has got elevated cortisol levels throughout the night. So that contributes to her frequent awakening, waking up unrefreshed, waking up early, and feeling completely crashed. So then she has this blunting, so it's not really a spike here, which means she's not really responding to any stress as well anymore. And then the cortisol levels stay elevated, and then in the evening it sort of crashes down. So she has got elevated cortisol levels pretty much throughout the day. And this is probably the most important slide of the whole talk. So if your cortisol levels are constantly elevated throughout the day, you can be on a ketogenic diet as much as you like. But if the cortisol is telling your liver to constantly make sugar, you can be as ketogenic as you like. Nothing's going to happen because your liver is pumping out sugar pretty much all day long. And what does the cortisol do as well? It slows down your thyroid hormones. It slows down your immune system. It slows down your digestion, everything. So everything comes together. And most of the reasons, or the most prominent reason why Jane feels the way she feels and why she doesn't have any success is because of these elevated cortisol levels throughout the day. So they're constantly slowing down her thyroid functioning and her liver is pumping out glucose pretty much all day long. Here we have the microbiome test results. E. coli was in significant undergrowth. So what's E. coli good for? So we need E. coli for the synthesis of tryptophan, phenylalanine, and tyrosine. So they're the precursors for so many important enzymes. She would be low in folic acid, vitamin K2, and CoQ10 because E. coli is not doing it. Streptococcus was way up. Streptococcus contributes to lactic acid and leading to an acidic colon, leading to leaky gut. Her primary bile production would be going down and the conversion to a secondary bile would be inhibited. She's got fat malabsorption happening. Remember, we need those fat-soluble vitamins for proper thyroid functioning and also for proper adrenal functioning. Her bacteroides are down, so the protection against pathogens is down. She doesn't make enough butyrate. She doesn't make enough short-chain fatty acids. And lactobacillus was way down as well. Lactobacillus is the main GABA producer. You cannot feel happy if you don't make GABA. So all the happy hormones, serotonin and dopamine, everything gets completely sabotaged by her gut dysbiosis. And of course, she had elevated zonulin levels, which is just a proof of leaky gut. So with this gut, no one functions well. You feel tired, you're not absorbing your nutrients properly, you feel exhausted, all of it. So this can all come from the gut as well. So now you may think, oh my God, there's so many things wrong. How can we help this patient? And I just want to quickly run through this because we're running out of time. What did I do for the patient to make her feel better? So first of all, we need to support detoxification. We need to eliminate as much toxins as possible. And then I refer my patients back to the checklist. What can we take out of our lives to make our life less toxic? And there's a page, ewg.org, which I'm often using. That's an American page which has examined so many personal care products that are toxic and they are actually endocrine disruptors. And then you can pick and choose those products that don't have the endocrine disruptors in it. So that's a good valuable source. We need to increase the cruciferous vegetables because they contain glycosinolates. So they are the broccolis and the spinach, etc. We need to have high quality proteins rich in sulfur, glycine, and cysteine. They are the amino acids needed for proper detoxification. It is really helpful to sweat at least once a day, so either with an infrared sauna or doing exercises. And often I give supplements, so once someone has regular bowels, I supplement with glutathione, N-acetylcysteine, pectosol, and vitamin C to support those detoxification pathways. We need to calm the immune system down, and then here again, detox, detox, detox. Toxins aggravating the immune system. We need to definitely eliminate the gluten. Gluten is a toxin. Gluten disrupts the gastrointestinal barrier and it can cause so much havoc on the immune system as well. We need to reduce the free radicals and bring up the antioxidants, the omega-3s. We need to have the vitamin Ds, the vitamin Es all in there, and the zincs to increase the antioxidants. Again, we need to relax, relax, relax. Stress is inflammatory. Inflammatory is immunosuppressant, and hence stress is also immunosuppressant as well. We need to really improve her sleep. She needs to get out of the cycle of poor sleep, elevated cortisol, and that in turn leads to poor sleep, and that in turn, again, leads to elevated cortisol. So we really want to aim for good sleep duration, 7 to 8 hours, improve the quality, minimize the disturbances, and we really need to reduce the alcohol. So some people think they can only sleep because of alcohol in the evening, but then once they're disconnected from that belief, sleep becomes much more refreshing. Alcohol does not give you a relaxed sleep and good quality sleep. So further to improve the sleep, I refer her back to the checklist, but I also want to change and help her with a few supplements, and that's melatonin. Melatonin is the opposing hormone to cortisol. When melatonin is up, cortisol should be down, and cortisol is down when melatonin is up. Passion fruit flower is a beautiful herbal supplement, which has been actually shown to be as effective as low-grade or low-dose benzodiazepines. So it really helps. It has a mild sedating effect and hopefully helps her to go to sleep much easier. I need to offer Jane something because she was so hanging on to the alcohol. So we need to replace that alcohol with something more healthy. And phosphatidylserine, that's something that's in your cell membranes. It's been used for anxiety and for brain disorders and Alzheimer's. So that's actually stabilizing the membranes as well. And it works fairly quickly. It gives that sort of mild sedating effect just half an hour after taking it. With the valerian, you need to take valerian at least 2 weeks non-stop to have some effect. So I don't really recommend it. For some people it may work, but for Jane we replace all of these supplements of her valerian. How can we further improve the sleep? Well, my saying is your nighttime sleep can only ever be as good as your day quality was. So really spend some time outside, bring up those vitamin D levels, do some gentle exercises, and watch the sunset as many times as you want to. At our retina, we have the densest population of melatonin receptors. So looking into the sky, looking at red light actually makes melatonin. So you have a higher level of melatonin if you just look at red light in the evening instead of screens and blue light and all of that. When it comes to the movement, for Jane, I recommend non-intensive exercises. So I ask her if she can stop doing the gym workout and just go for long, slow walks. And I also ask her if she can stop jogging her dog and walks her dog instead. So for Jane, I would really not recommend any intense exercises. So more like anything calming and relaxing, because every time she does intense exercises, she brings her cortisol levels up again. And how was the cortisol level for Jane? It was high enough as it is. So we don't want to have any more input in high cortisol activities. As for the food, she was on a very low ketogenic diet. I would like to bring that up a bit, because if you change too drastic, it brings up the cortisol levels. So I would like to have her between 50 and 80 grams a day, and then have whole food, clean food. So get away from these non-organic foods, get away from anything inflammatory, no oils apart from avocado oil or olive oil, nothing that increases the inflammation. I also prefer to have maybe 3 meals a day, because that will bring the cortisol levels down. Have good 3 meals a day, and of course no snacking in between. I wouldn't recommend for her to fast longer than 10 hours. That's probably a good range. Yes, the fasting time will also help her to clear out her insulin and get metabolically more healthy. But I think we need to work on the adrenals and the thyroid before we can work on the metabolism or optimizing the metabolism. Chew your food at least 30 times. That's so auto important. Not only do you digest better, but it's also you take your time and eat your food as opposed to just scoffing it down. We need to increase the fiber significantly, because she does suffer occasionally from constipation, and I want to really bring that up. And avoid any stimulants as caffeine and sweets and chocolate and any flour and hydrogenated oils and all of that. So have a nice, clean, low-carb diet. It doesn't have to be ketogenic. I think the ketogenic diet would have brought her backwards a little bit. And of course, we need to support her adrenals. So with good omega-3s, B vitamins, vitamin C, magnesium, and zinc, as well as supporting her thyroid with the essential nutrients she needs. Vitamin A, zinc, selenium, magnesium, etc. And she needs high quality meats to bring all of these numbers up. And if someone is so compromised, especially if the gut is in such a dysbiosis, I would supplement until everything is sort of back to normal. So I have to race through this now. So we resetted her gut with the 5R approach. Remove all the stressors and gut irritants. Replace the nutrients you need. So that's the supplementation which I would do temporarily. Reinoculate, so we have rich pre and probiotics, so that was specifically designed for her. Repair the intestinal gut lining, and that often involves alkalizing because it's too acidic, and rebalance of the lifestyle factors. Really chill out. Have high fiber to accommodate the Bacteroides, and stop feeding the Streptococcus and make your gut more acidic. So that's in a very short run what we did with her gut. Another very important point is like reducing the stress. And here I must say relaxation must be learned and practiced. Most of my patients get it and they understand it, but they just don't do it. They say, oh yeah, I should do, but they never do it. So really avoid those stressful situations, turn off the TV, go outside instead, and focus on really pleasurable activities. Redirect your mind, don't think about the bad stuff. Do some abdominal breathing, laughter, singing, or just cuddle with your animals. That's all so beneficial and so effective to reduce the stress levels. I often use adaptogens. So here are my favorites. So adaptogens are basically herbals that improve and normalize the functions of the body's response to stress. So, and here the adaptogens are always depending on the current cortisol situation. So all of these are bringing the cortisol down, or they normalize the cortisol response. So I like ashwagandha because they're slightly anxiolytic as well, and they improve cognitive function. Holy basil is not only improving the cortisol levels, but it's also improving the anti-inflammatory response, and it acts like an antioxidant. L-theanine is part of green tea. So and it's really helpful because it's normalizing the cortisol response, but it's also anxiolytic and it increases the alpha brain waves. So that's what we have when we are alert yet relaxed. And rhodiola. So again, it tackles fatigue and the stress or fatigue stress and insomnia. So it's all very beneficial sort of adaptogens which I'm often using. So to summarize all of this up, we are not designed to be stressed and toxic and inflamed and thrive and grow and flourish. So this is just not a natural combination. So healing comes from the parasympathetic state. Again, we need to calm the adrenals down, we need to calm the immune system down, and that will calm the thyroid down, and everything works better. And then Jane was actually able to heal and recover herself. I hope you found this useful and could take a few points home. So again, Jane was well on her way, and once we basically addressed all the underlying root causes, she was actually able to lose weight and had so much better sleep and felt so much more energetic by just addressing some root causes which she couldn't address with just a ketogenic diet. I hope you have a wonderful day. Bye-bye.